Hi, Vanessa. We are live.
Hey, Eddie. Should I start now?
Yes.
Yeah. Okay, good morning, afternoon, or evening to those attending. My name is Vanessa. I am the Program Officer at YouthLead, the regional network on Yankee populations, and I will be moderating for the introduction of today's high-level meeting slide event that is jointly organized by YouthLead, UNFPA APRO, UNAIDS RSTAP, UNICEF EAPRO, and the UNDP Bangkok Regional Hub. Excuse me. The inspiration for this slide event comes from the leadership and innovations of Yankee populations in the HIV response in the Asia and the Pacific. The Asia Pacific has vibrant Yankee population initiatives that are led by national and regional Yankee population networks that are in partnership with government, civil society, donors, UN, and other technical partners. Numerous advocacy campaigns and innovations have been spearheaded, leading to an enabling environment for Yankee populations to access essential HIV services, harness the leadership, and reduce stigma and discriminations. The objectives of this slide event include highlighting Yankee population-specific issues from the Asia Pacific to a global audience and member states, and shed light on the bulging HIV epidemic amongst Yankee populations in the region. Showcase Yankee population initiatives and advocacy efforts in the region. This event will offer good examples of Yankee population leadership and their contributions to the HIV response, including the COVID-19 response, and to share lessons learned from innovative HIV and SRHR programs targeted to Yankee populations. We have an exciting lineup of speakers today, so let's get started. I would like to introduce Ika Domianti, the Advocacy Officer at YouthLead. Ika has experience working with key population networks at both the national and regional levels. Her role as the Advocacy Officer, Ika is responsible and represents YouthLead at various workshops, consultations, and forums to ensure the needs of Yankee populations. So Ika, I'll hand it over to you.
Thank you so much, Vanessa. Good morning, good afternoon, and good evening. My name is Ika Novianti, and I represent YouthLead, the Asia Pacific network of Yankee population. It is my pleasure to speak here at this virtual event. Firstly, I would like to thank UNAIDS Regional Support Team Asia and Pacific, UNFPA Asia and the Pacific Regional Office, UNICEF EAPRO, and UNDP Regional Hub, which helped organize this virtual meeting. More importantly, I want to acknowledge all my colleagues in YouthLead who helped make this event possible. I also want to thank Ambassador Dr. Stephanie Williams for joining us in our event, and all our panelists for agreeing to speak today, and everyone tuning into the live stream. I want to quickly commend all young people who have been at the forefront of the COVID-19 pandemics, which has affected many countries across the region. Their leadership and commitment to support Yankee population during this crisis have been incredible. Young people are indeed at the forefront of the pandemic and are the drivers of change. So today I'm here to speak and remind you of the importance of youth engagement, the critical role of Yankee population play in HIV response. So since the 2016 high-level meeting on HIV and AIDS and the political declaration, we are still far from reaching those agreed targets. So the last political declaration was significant because it was the first political declaration that mentioned and acknowledged the needs of key population, demonstrating the critical role civil society plays in pushing for progressive language and targets, and recognizing the leadership of young people in the AIDS response. Since the last HLM, we have seen more and more young people take up space in the decision-making process. Young people continue to build the capacity of other young people and are establishing meaningful partnership and mobilizing resources to support local and national organizations. Since the beginning of the epidemic, the community-led response has been vital in tackling not just HIV, but the myriad social issues and factors to come with it. Despite the critical role of communities play in the response, Yankee population are often marginalized and seen as the beneficiaries of program rather than leaders and implementers. There are many initiatives led by national and regional Yankee population network in partnership with the UN and other technical partners in the region. Numerous advocacy and initiatives have been spearheaded, leading to enabling environment for Yankee population to access essential services, harness their leadership, and reduce stigma and discrimination. However, such initiatives are sporadic and are not well spread consistently across the countries. There still exists a huge programmatic data, funding, and policy gaps to address the Yankee population issues. We almost work on this. The meaningful engagement of Yankee population within the HIV response, Yankee population must be empowered and meaningfully engaged in the decision-making to guide an effective HIV response. We are leaders, partners, and implementers. We are not just a tick of the box. Our voice matter, our concerns matter. We need to make sure Yankee population and youth-led networks are given meaningfully support to ensure the sustainability of funding or for the critical programs. So I hope you all enjoyed the conversation to follow and ask the question for the panelists. Thank you so much.
Thank you so much, Ika. I would like to now invite Dr. Stephanie Williams, Australia's Ambassador for Regional Health Security. As Ambassador, Dr. Williams supports the advancement of Australia's interests in the Indo-Pacific by fostering linkages between Australia's world-class public health and medical research experts and partners in the region. Dr. Williams is a public health physician epidemiologist who has been DFAT's principal health specialist since 2017. So Ambassador Williams, I would love to hand it over to you. Thank you.
Thanks for the introduction, and thanks for today's organisers, Youth Lead and the Asia Pacific regional offices of UNAIDS, UNFPA and Unicef. I'm Dr. Stephanie Williams, and as Australia's Ambassador for Regional Health Security, today I wanted to share some reflections on Australia's journey in the HIV response as we look forward post-HLM to the next 5 years. But before I do, can I say how nice it is to see the familiar faces from the official consultation we had on young key populations but a few weeks back, and to echo my acknowledgement of the leadership of young people that has culminated in this official side event for the HLM today. But back to the reflections. Since the emergence of HIV/AIDS in the 80s in Australia, the focus has always been to bring both sides of government together, service providers, researchers, and most importantly, communities or key populations. And the shared mission has been to reduce transmission of HIV, deliver effective treatments, and minimise personal and social impacts. Today, we're proud that AIDS is considered virtually eliminated, and the transmission rate of HIV is amongst the lowest in the world. Whilst the journey hasn't always been smooth, what we've learned along the way and must continue to learn is that the voices of communities are key. In particular, communities of people living with HIV, those key populations at high risk, and young people. And not just voices to be listened to, but voices that should be part of the solution, the way we design services to meet needs. We know the global response is faltering, and the risks to young people in our region is of real concern. Of 310,000 new HIV infections in the Asia Pacific in 2019 alone, more than a quarter were amongst young people between 15 and 24 years old. We don't know exactly why some young people are being infected when others aren't, but we do know children under 14 and young people under 24 have more trouble accessing treatment. And we also know, and as brilliantly said by Novianti at the beginning, that young people should be leaders in the response, not just beneficiaries of other people's good ideas, and that the inclusion of adolescents and young people living with HIV in decision-making, in community-led service delivery does improve access to treatment and can lead to better management of HIV infection. Australia's HIV prevention model includes programs created for and created by young people in affected communities, including gay and other men who have sex with men, trans and gender non-conforming people, and Indigenous peoples. And these types of peer-led programs provide safe and inclusive platforms for young people in affected communities to connect, share their experience, access information, and more importantly, or as importantly, shape responses. This is a really important time in the global HIV response. Let us work together to ensure this high-level meeting held this week drives our regional action where we need it most and ensures that the important gains are not lost despite the COVID pandemic, which continues to challenge us all. Post-HLM, the realities of young people in all their diversity needs to continue to inform the regional response. Sharing your knowledge, sharing our knowledge of what works, innovating in ways that allows HIV prevention to reach young people and being accountable for outcomes is crucial. I commend you for your ongoing commitment to finding innovative ways to prevent new HIV infections and ending AIDS, in particular in young people. Thank you for the opportunity to speak today.
Thank you so much, Ambassador Williams. I would now like to invite Taufik Bakali, the UNAIDS Senior Strategic Information Advisor for Asia and the Pacific and the manager of the Regional AIDS Data Hub at the UNAIDS RST, a portal that collects, manages, and disseminates data on the HIV epidemic. So I'll hand it over to Taufik.
Thank you so much. Great to join you here for this event. Your Excellency, Ambassador Dr. Stephanie Williams, Vanessa Monley of Youth Lead, Ika Novianti of Youth Lead, nice to see you again. Dear distinguished participants, it is my great pleasure to welcome you to this virtual side event on young key populations, leadership and innovations in the HIV response in Asia and the Pacific, which is held as part of the United Nations General Assembly high-level meeting on HIV and AIDS. I would like to begin by expressing my utmost gratitude to the Government of Australia, Youth Lead, UNFPA Asia Pacific Regional Office, Unicef East Asia and the Pacific Regional Office, UNDP Bangkok Regional Hub, for their collaboration with UNAIDS Asia and Pacific to co-host today's virtual meeting with us. In advance of the important high-level meeting, where a new political declaration will be adopted, today's HLM side event will present and discuss the HIV situation among young key populations, progress and challenges in the HIV response, and share lessons learned and testimonies from young key population leaders. But first of all, let me echo Ika and emphasize the importance of youth engagement in the HLM and the critical role young people play in the HIV response, demonstrating already a very strong leadership that needs to be recognized. As pointed out by Ambassador Williams, peer support groups and the inclusion of young people in decision-making and in community-led service delivery improve access to treatment and HIV prevention. Since the last HLM in 2016, we have seen more and more young people demonstrating their leadership, taking up space in decision-making processes, establishing partnerships, and mobilizing resources to support local and national organizations and implementing the response. But we need to do more. In 2019, 27% of all new HIV infections in Asia and the Pacific were among young people. But in several countries, this share is around 50% of all new infections. Young MSM accounted for over half of all new infections among youth, and overall, 99% of the new infections among young people were among young key populations and their partners. Significant barriers exist for young people, for young key populations, particularly in the region, to access HIV testing, prevention, and treatment services, as well as, more importantly, the routine and basic sexual and reproductive health and rights services. These barriers include limited availability of differentiated HIV service models for young key populations, as well as strong existence of stigma and discrimination, punitive laws, and other legal barriers that leave young populations on the margins and out of reach for HIV services. Currently, only 40% of countries in the region have non-restrictive laws or regulations that allow people aged 10 to 19 years to seek HIV testing without parental consent. In the lead up to the high-level meeting, young leaders rightfully asked member states to include the term young key populations as a distinct entity in the political declaration to acknowledge their unique situation and to address their priority issues. The HIV programs need to be redesigned to fit the needs of young key populations. Scaling up youth-friendly and prevention and treatment services is essential. Young people play a critical role in leading the change and promoting successful innovative approaches. That is why it is important to continue to empower young people and young key populations and meaningfully engage them in the HIV response to make a difference. They have already demonstrated the ability and their leadership, and they need to be given that space. For example, young key populations-led organizations are utilizing online and virtual spaces to increase the uptake of HIV services. And who better can do it than the young people? They do also provide mental health support and continue to raise awareness about HIV prevention. During the COVID-19 pandemic, civil society organizations, including young key pops-led organizations, have been at the forefront of the HIV response, providing HIV services to communities that need them most, including home delivery and pickup of ARVs. Today, we will hear some successful stories about how young key populations-led organizations have stepped up and supported their communities during the COVID-19 health crisis. Innovations that have started during the COVID-19 pandemic, including differentiated service delivery, must be institutionalized and scaled up. This year's high-level meeting will be the springboard for a decade of action to reduce inequalities and root out the social determinants that fuel the HIV epidemic. UNAIDS urges the governments to take the actions needed to move forward in the HIV response and ensure that young key populations remain as a key priority. I hope that this young key populations side event may lead to a foundation for future action and collaboration to better understand the priorities and concerns of young people in the Asia Pacific region and respond to them. I wish you a very successful event. Thank you.
Thank you so much, Taufik, for your really inspirational words. I will now hand over to Maki Akiyama from the UNFPA AP Regional Office.
Thank you so much, Vanessa. My name is Maki Akiyama, and I work with UNFPA Asia Pacific Regional Office as a program analyst for adolescent and youth. And it's my great pleasure to moderate this session too. This session will set the scene for our discussion today by highlighting key issues of the HIV epidemic among Yankee population in this region. And our first presenter is Dr. Yeyu Xue. Dr. Yeyu Xue is a regional advisor for epidemiology and response monitoring at the UNAIDS Regional Office for the Asia and the Pacific. And he's one of the long-serving team members of HIV Regional Data Platform, HIV and Data Hub for Asia and the Pacific. He has more than 18 years of in-country and international experience in both clinical and programmatic aspect of HIV and health response. He provides technical support to countries in the region in strategic information generation and use, disease impact modeling, estimation, and program evaluation. He will walk us through an overview of the regional HIV epidemiological data on Yankee population. The floor is yours, Dr. Yeyu Xue.
Thanks, Maki, for this very nice introduction. And yes, I have a short presentation, and thanks, Gash, for helping me in this and projecting this presentation. So so let me start with my my presentation. So good morning. Let me introduce and greet first. Dear distinguished representative of young people and partners and colleagues and Ambassador William for supporting this Yankee population events in the Asia and the Pacific. So on behalf of UNAIDS, I'm delighted to be part of this very important HLM 2021 virtual side events. And thanks for inviting me to speak at this plenary panel discussion. Let me and allow me highlighting the key issues of the HIV epidemics among Yankee populations in the Asia and the Pacific region. So let me commence with my my presentation. Next slide, please. Okay, in Asia and the Pacific, it is home to the 5.8 million people living with HIV, and it is the second largest HIV epidemic among regions in the world. We have about 300,000 new HIV infections in Asia and the Pacific, and there is the about 160,000 AIDS-related deaths. As you can see in this slide, the young, can you press next? So as you can see in the slide, the young people aged 15 to 24 years accounted for more than a quarter of all new HIV infections in the region. And adolescents 10 to 19 years account for 7% of all new HIV infections in the region. So you may think about the 27% of young people 15 to 24 years among all new HIV infections might be not that much. But if you consider the age bracket of young people that you are seeing here, 15 to 24 years, which is the 10 years, let's say among the within the roughly the life expectancy of the average people 70 years. So it is quite a lot. And if you consider those year life loss and then year live with disability among young people who are infected with HIV infection, it is actually quite a lot, and it affects the productivity of the countries and the regions, countries and the region as a whole, or in Asia and the Pacific, if our young people are that much infected with the HIV infection. And if you look at the other way around, in a simple way, like if you can see the bottom of the slide, in every hour we have 9 young people are getting infected with HIV. So if you think about that, or maybe if you put it in a simple way, after we talk about 2 hours in this HLM side event, and then we have 18 young people are infected with HIV in our region. So it is not little, it is quite a lot. And don't mind about this, the 2018 in the red cycle, it is a typo, it should be 2019. Can you go to the next slide, please? So talking about the HIV infections among young people, you may want to know who are getting infected with HIV in this young population. As you can see clearly in this slide, about 99% of all new HIV infections among young people are happening among Yankee populations and their partners. So if you can see, if you look at a bit more closely, a big chunk or a big bulk of the HIV infections are occurring among young MSM, which is about 52%, and then followed by the young clients of sex workers and their partners, and young people who inject drugs, and young sex worker and young transgender people, accounting about 19%, 10%, 10%, and 8% respectively in the region. So cumulatively, it accounts for 99% of all new HIV infections are happening among Yankee populations and their partners in their region. So so it really highlights the needs of the for the focus and diversifying HIV response targeting the young people, Yankee populations in our region. Next slide, please. So build on the previous slide, this slide gives some example of the high level of HIV infection among young MSM. You can see in the left panel, the high level of HIV prevalence among young MSM in the cities. For example, in Kuala Lumpur, 1 in 3 young MSM are living with HIV. In Kanto, 1 in 4 or 25% of young MSM are living with HIV. If you can see on the on the left panel, on the right panel, there is the the information sharing about the China cohort study. In this age, the young people, digital technology and the social applications are inseparable. So this cohort study shows that the use of the geosocial application and level of HIV incidence. So high HIV incidence among MSM who are using the geosocial application is it was 8%, and whereas the it was 2% in those who are not using the geosocial application. And the right lower panel show the incidence by type of the application that they use. So it clearly highlight the the indicated the indication, or the highlights the innovative virtual intervention using these geosocial applications and platforms can be very effective for those who are at high risk of HIV infection and who are not reachable through the traditional the physical outreach interventions. Next slide, please. So it is a bit complicated slides, but the key message giving here is that young people, more specifically Yankee populations, are getting infected with HIV, but certain laws, policies, and practices and regulations are prohibiting the young people from accessing HIV and health service they need it. As you can see in the right bottom panel in the pie chart, only 45% of the countries in our region allow the HIV testing for the young people without parental consent. And then we have the rest, 34% still require certain age limit to get the prior consent to get the HIV testing services. So the left upper panel show the countries where the rising HIV infection among young people, and the graph below also show the proportion of the young people among total new HIV infections that are higher than the regional average. So you may recall that in the very first slide, we talk about there are 27% of all new HIV infections in Asia Pacific are occurring among the young people. And these blue bars show that the countries where the HIV is heavily impacted among young people, for example, like Philippines and Thailand and Myanmar and Laos. So in these countries, the HIV is heavily impacted the young people. Next slide, please. So in the previous slide, we have seen that the young people are at great risk of the getting infected with HIV, but this slide show that our young people, or many of our young people, do not have enough knowledge to protect themselves from getting infected with HIV. As you can see, the regional media indicates that only a quarter of young people who have comprehensive knowledge of HIV infections. Among them, some countries are very low level of HIV knowledge among young people, for example, like Afghanistan and Pakistan, where there is only 2 or 4% of the survey young people do have the comprehensive HIV knowledge to protect themselves from getting infected with HIV. So next slide, please. Okay, this slide show that despite the high rates of HIV infections among young people, Yankee populations, they are insufficiently reached by the HIV services. In the graph show, HIV testing coverage is as low as 23% in Philippines and 8% in Laos and 10% in Bangladesh among young MSM. And if you look at the young female sex worker, there is about 11% HIV testing coverage in Pakistan, and there are about 24% and 31% respectively HIV testing coverage among transgender in Malaysia, in Pakistan and Malaysia respectively. If you look at the young PWID, the testing coverage is among young PWID in Bangladesh, for example, like Malaysia, Philippines, and Myanmar. About 70% of young PWID are not knowing the HIV status, so then they can access to the the treatment services and health services that they need. So go to the next slide, please. So this slide, the prevention programs, as you can see, are not reaching to the key populations, especially young key populations. Even before the time of COVID-19, this is the data from the 2020 GUM reporting, mostly from the 2019 and earlier data. So even before the time of COVID-19 pandemic, the countries were not able to meet the prevention targets, as you can see in in the slide. So the service delivery for the HIV combination prevention needs to be innovative and differentiated, and address the needs of the young key populations in various contexts. context, particularly in their own country context and in their own local context. This is very important so that we can provide the available, accessible, acceptable, and quality health services to the Yankee populations. Next slide, please. So this slide show the results of the rapid survey conducted by the Interagency Task Team for the Young People, the IATT of YKP of Asia and the Pacific, and the assess to the it's assess the information on the the need of medication on hand, and assess to the HIV services among Yankee populations in Asia and the Pacific during the COVID-19 lockdowns. This is very I think one of the very early interventions in the when the COVID-19 pandemic is started, and I salute to the Yankee populations and UNAIDS and all the partner organizations support this assessment happen in very quickly and very efficiently. So it shows about 1/3 of the Yankee population experience delay or disruptions in the services, such as in assessing services such as condoms, the HIV testing and the psychosocial support. So Yankee populations actually are not assessing to the sexual and reproductive health services and HIV prevention services, and they are actually experiencing the profound psychological, the impact due to the COVID-19. This survey reveals. Communities actually, the Yankee population community are like Tofik mentioned earlier, are the very integral part of the enabling continue HIV services for the Yankee population themselves, and particularly for those who are hardest to reach at the time of the COVID-19 pandemic, lockdowns and all the restrictions, etc. Next slide, please. So this is my conclusion slide, last slide. So we have seen the overview of HIV and response situation among young people, particularly among Yankee populations in our region. As you can see, the Yankee populations are disproportionately affected by HIV. So if you remember this, 99% of all new HIV infections among young people are occurring among Yankee populations and their partners. And again, particularly if you look at the age bracket of this 10 years age bracket of the young people within the life expectancy, please go back. Life expectancy is 70 years of the average people. So it is quite a lot of proportion that young people are getting, particularly Yankee populations are getting infected with HIV. So this issue is really significant and very important issues for our region. And there is a significant HIV service gap among Yankee populations, and particularly COVID-19 further enlarges these gaps. And when you look at it, is particularly concerning when the policy and legal barriers are deterring the young people access to the health services. And last but not least, that we always talk about when it comes to the data availability for the Yankee populations, it has been a long-standing issue that not enough information are generated, collected, analyzed, and used to guide the programs. This is a very important issue. And I would like to echo the previous speakers, Ambassador William and Ika highlighted about their participation and their leading role in this particular activities, which means the collection and generation and analysis and use of this data and information that can be applied to the Yankee population programs. So we do need a comprehensive and robust information of epidemic and response by location, population, and age groups, so that we can strategize the tailored response to effectively tackle the HIV epidemic among our Yankee populations in our region. And we do need the very strong and in continued collaboration and lead of the Yankee populations in this very important agenda moving forward. Thank you. I thank you all, and then I'll stop here, hand it over back to Rika.
Thank you so much, Dr. Yeyu. Thank you so much for sharing such a comprehensive picture and highlighting the areas that need further attention, which included HIV service gap, legal barriers to services, and limited data, and also innovative use of such data. Now I'd like to invite our next presenter, Fletcher Chu, who is an HIV advocate for PRAA, a People Living with HIV Rights Advocacy Association in Taiwan. He was also involved and empowered by Treat Asia's program called Youth Asia Community for AIDS Trans Treatment and Advocacy. He currently sits as board chair of Youth Lead, the Asia Pacific network of Yankee population. And Fletcher will talk about key issues and challenges Yankee populations are facing in our region. The floor is yours, Fletcher.
Thank you, Maki, for the introduction, and Yeri for the overview and important updates. Hello, everyone. My name is Fletcher Chiu. I'm based in Taiwan, and I'm currently sit as board chair of Youth League. So moving on from the data of YKP, I'm going to talk about the issues and challenges facing Yankee population in Asia Pacific region. So despite the nuances in the region, such as different HIV epidemic and key population response, there are still barriers and gaps that are commonly shared by Yankee population in our region. So Youth League and UN partner has conducted a YKP data initiative, including literature review and focus group discussion with key informants from youth-led organizations and networks to delineate the unmet needs of Yankee population. As I'm one of the team members, although the report has not been finalized, several key topics prevail in the preliminary findings. So I will go through the following 4 topics, including service availability and accessibility, enabling environment and legal barrier, ownership of program design and demand for disaggregate data, and last, funding security and sustainability. So first, service availability and accessibility. In many countries, data indicate that YKP have less access to HIV services and information than their older counterpart. Likewise, healthcare systems that have programs for young people may not have programs tailored to unique need of YKP. So from the availability perspective, HIV services, including prevention and treatment, are widely available across Asia Pacific. However, there are few differentiative services dedicated to YKPs and young people living with HIV. In most cases, differential services for YKPs are community-led services provided by civil society organizations with international funds. They are usually on a small scale and urban-centric, which leaves a large group of YKP behind. And as for accessibility, YKPs are at a greater disadvantage than adults as they navigate HIV services that they are not designed for them. They often find that public clinics are not youth-friendly, which only open on working day during office hour. There are often long waiting times and few integrated services, which may mean that another visit may have to be made. In addition, YKP often find that service providers do not have necessary knowledge or resource to respond adequately to their needs. So the findings suggest that service should be integrated into government health and SRHR services so that young people can receive education, prevention, testing, retention in care, follow-up in treatment, psychosocial support, and harm reduction services if needed. And coming down to the second part, enabling environment and legal barrier, I think it's very familiar to us that stigma and discrimination and legal barriers remain big issues where religions and cultural may play critical roles. And criminalization of drug use, sex work, same-sex relationship, and the law that breaches rights and put barriers to accessing HIV testing, treatment, and prevention, harm reduction services, as well as the criminalization of HIV non-disclosure, exposure, and criminalization hits this marginalized population harder. Currently, more than half of countries in the region have restrictive law that do not allow people aged 10 to 19 to seek HIV testing without parental consent. And UNAIDS published a document called Legal and Policy Trend Impacting People Living with HIV and Key Population in Asia Pacific, which has more detailed information. So for a safe space to be made, anti-discrimination law must be enacted and enforced. Punitive law must be removed. And member states and governments are held accountable to address this in political declaration during this high-level meeting dialogue. And the third part, ownership of program design and demand for disaggregate data. And many innovative prevention services like PrEP and self-testing and new delivery modes like Yankee population-led service delivery and use of virtual space and digital platform were documented during this initiative. And it demonstrates that young people, including Yankee population, are not just beneficiaries, but also leaders and implementers. young people should be allowed to design their own programs and implement them. Youth-led services and innovation need to be institutionalized and scaled up in the region. And also the data of the program should be disaggregated in order to monitor trends and fill the major gaps in knowledge about Yankee population. And the last part, and I guess important part as well, funding security and sustainability. Although there are promising programs by youth-led organizations in the region, assessing large donor fund remains a challenge for a smaller youth-led organization. Competition for funds and shrinking of civil society space are barriers to security and sustainability. And more specifically, youth-led organizations most likely will miss out the funding opportunity due to lack of experienced external support from civil society, government, or other key stakeholders. In most of countries, domestic funding and resources do not exist for Yankee population. So to end, I would like to quote a colleague saying that we young people know the market because we are the market. Sustainable funding for YKP-led initiative, including YKP-led service delivery and advocacy, without restrictive and burdensome application, and the reporting process can be the game changer. Thank you, everyone, and thank for Youthly for this opportunity to join this amazing side event. And Maki, over back to you. Thank you.
Thank you so much, Fletcher, for so nicely summarizing the issues and also providing very concrete recommendations, and also particularly highlighting the needs of engaging Yankee population at all stages of implementation. So thank you so much for that. And so now we have reached the end of our session, and I would like to once thank again Dr. Ye and Fletcher for setting the scene so nicely and painting the overall situation of Yankee population in Asia and the Pacific. And now I would like to hand over to Hani, who will moderate the session 3. Floor is yours, Hani. Thank you.
Thank you, Maki. Thank you so much. What an honor it is to be part of such an important meeting highlighting leadership and innovation in young key populations in Asia and the Pacific. So in today's panel, we'll be looking at access to differentiated HIV prevention and treatment services in Asia and the Pacific. We will be hearing from 3 different actors in the forefront of the HIV response and from 3 very different backgrounds and areas of expertise. The themes explored in this session will include HIV prevention innovations, including HIV self-testing and PrEP for YKPs, HIV treatment and enrollment in care among young key populations, including ARV, MMD, and co-infections, and integrated HIV, SRHR, mental health, and other health services. So with that said, I'd like to introduce our first speaker today. So that is Don Tan Tung. Tung is the Executive Director of Lighthouse Social Enterprise and Lighthouse Clinic. This organization is 15 years old and is a YKP-led organization in Vietnam. He is an active community health and HIV activist. He's also a community researcher with more than 10 years of experience working and fighting for key populations and people living with HIV's rights and health, especially young and most vulnerable ones, to ensure their well-being and equity. So Tung, if you could open your camera for me. Good afternoon, Tung. So Tung, can you please tell us more about Lighthouse's work on prevention innovations in Vietnam? These include HIV, self-testing, and PrEP for young key populations, because I know that Lighthouse has been at the forefront of some of these innovations, not only in Vietnam, but as a great lessons learned for the entire region. So over to you, Tung.
Thank you very much, Hani, and hi everyone. Thank you very much for having me in this, I think, very crucial event for young key population in the region. And I also prepare some, sharing with you about the Lighthouse and also our work in service delivery for the community. So my name is Tung, and I'm Executive Director of Lighthouse and Young Key Population Lead Organization in Vietnam. We also have one Lighthouse clinic to provide the friendly and safe spaces for the community to access to the information and services on HIV and the other sexual health services and information. So talk about the young key population in Vietnam is, young key population still contribute significantly in the HIV new infections in Vietnam. And, you know, people still face with a lot of barriers and difficulties in accessing the information and services. I want to echo with Fletcher's about the summaries of the Yankee populations studies with Youth Lead. In Vietnam in 2020, we also organized and conduct Yankee population studies. And we find the similar findings with the study with Youth Lead. So, you know, a lot of Yankee populations still lacking of, you know, fundamentals, knowledge and information about HIV and AIDS, you know, about the sexual health as well. Many of them don't have the accurate information about the HIV testing, treatments, and also the other harm reduction services as well. And many of them also face with stigma and discrimination, including the self-stigma, and it's still the most, and also, you know, the major barriers in accessing the services among Yankee population, in combination with unfriendly services from the public health system and the other related services as well. And lastly, inappropriate law and policy is also really influenced and, you know, barrier for the community to get the equal access to the services. So from Lighthouse, based on those, you know, data from not just only our study, but also the other studies, we implement several intervention and prevention. And for now, because of the COVID, so we implement a lot of internet-based intervention and online to offline intervention as well. So the first, I think, is very key elements of our intervention is to be the community engagement and community empowerment. So we do several the focus group discussions and the in-depth interview with the Yankee population to really understand about their issues and about the needs of the services and what is the barriers that barrier them to access to the services. We also trained and, you know, hire the key educators from the community itself, from key population, to implement the service delivery, demand generation, behavior change communication. I mean, like all of the activities and services that is led by and implemented by the Yankee population. And the second element, I think, is the maximize and optimize the internet and you know, now as we talk about the big data, we talk about the internet and how can we optimize that. So we're trying to use a multiple of the social media channels where community exists and where we can reach to the community to provide the information and also link them to the services, including HIV services, HIV self-test, HIV testing, HIV treatment PrEP and PEP, and the other services as well. You know, diversifying services and also delivery matters is very key of success of our program, because we know that the environment has changed day by day, and community, they have different needs and they have a different way to connect and, you know, to receive the information. So we have to know about it. We have to engage them to provide in the right way and make sure that people can reach to the service that we provide. So we have the on-site services at our clinic. We also have the connect to the other services in our area, like other private clinic and also the government clinic as well. We also provide the mobile services in the community hotspot, community events, and we also organize several the community event to you know, generate the demand and also link them to services at the event. And home-based services is the new strategies. We have the HIV self-testing. We have the harm reduction commodities. We can mail the test kit and also commodity to the client home, and they can use it at home. And very near, we can apply it with the PrEP as the Vietnamese government is going to approval for the online PrEP as well in the future, in the near future. And I think a very essential element of this service delivery is to be the friendly services, and where we can provide a safe spaces for the community they feel they belong to, and they feel they be respected by the health provider. That is very key, and I think if we can address this, many Yankee population can access to the services better. And lastly, community connections. There are still a lot of the self-stigma and the domestic stigma among the community itself. So we need to bring people together and understand each other, and this can address the self-stigma, internalized stigma, and then we can foster the services among the community. So in last year, we reached about the 50,000 Yankee population, and we provide more than 3,000 services to more than 3,000 Yankee population in Vietnam. It's including the HIV counseling and testing. We also provide the PEP and PrEP. We also provide the ARV treatment on site at our clinic, and also link people to the other needed services like STD testing and treatment with the mental health, psychological counseling and therapies, and also with harm reduction services for cancer community as well. So in conclusions, all by all, I think the very keys in here, I want to emphasize that community engagement and community empowerment are very key. We have to understand the community to provide the appropriate services for them, and then engage them in the all level of our activities and process. And then I think also maximize and optimize and provide the differentiated service delivery based on the community needs. And HIV is not only the concern from the community, but the other related services such as mental health or harm reduction also very important. So I want to end my speak here, and thank you very much for your listening.
Thank you so much, Tung. Thank you for highlighting how interventions need to be agile and reactive to the community context and to the needs. I think there can be really great lessons learned by hearing about the way in which Lighthouse social enterprise are constantly adapting to the needs of the community, which you said, and also reaching out to the community and empowering them. Right, empowering them is such a key aspect in order to really understand what they need, and so that they feel that they have a voice to express what their specific needs are. And also thank you for highlighting a very simple but very key aspect, that health services need to be a safe space, right? I think sometimes people forget how important it is to provide a safe space and to provide services that people can reach out to where they feel like their communities and their needs are being heard. So thank you very much, Tung. Please don't go anywhere. We'll have a Q&A in a bit. But for now, I'd like to introduce our next speaker. So our next speaker is Yvonne Marie Rafael. Yvonne is currently a consultant at the Council for the Welfare of Children, the focal interagency coordinating body of the Philippine government, which is mandated to coordinate the formulation, review, monitoring, and evaluation of all laws, policies, and programs on children. She's also working on adolescent sexual reproductive health, particularly on HIV and AIDS. So Yvonne, thank you for joining us today. Could you please tell us more about your experiences and the experiences of perhaps other organizations in the Philippines in providing integrated services? This includes the benefits of integrated services, and also it would be great to hear how the Council for Welfare of Children is working specifically with Yankee populations and YKP-led organizations in decision-making and service delivery. Over to you, Yvonne.
Yep. Hi, hello. This is Yvonne from Council for the Welfare of Children. It is a pleasure to speak to this event. I'll be discussing the integrated HIV, sexual reproductive health rights, mental health, and other health services in the Philippines. So as we all know, the world is faced with a new health and humanitarian crisis in the form of COVID-19 pandemic, and the Philippines, along with other countries, has imposed lockdowns and physical distancing in order to mitigate the impact of the virus. So mass gatherings and non-essential travels were prohibited, and classes shifted from offline to online modalities. So although this is one of the most effective way of not containing the virus, this unfamiliar situation has also negatively impacted individuals, especially the youth. On top of the disruption of normal lives, economic insecurity, and risk of violence and sexual abuse, mental health issues has been prevalent, especially in young people. It can be very frustrating to deal with the restrictions on social activities and simultaneously with the aforementioned struggle. These reasons are clear indications that we need to listen to the youth and understand them. So while the government is geared towards containing the virus or flattening the curve, there is also a need to innovate and pilot complementary models of service delivery, considering both adolescent health and child protection. So that is why we were able to come up with the Young House Heroes initiative. So the Council for the Welfare of Children, UNICEF Philippines, and the Positive Youth Health Development launched the Young House Heroes initiative. This is a youth-led and youth-centric program that focuses on young people's participation and engagement in time of pandemic, which also focuses on mental health and psychosocial support initiative, adolescent health and reproductive health, and child protection. So the program aims to promote the holistic well-being of children and youth in times of crisis. By one, gathering relevant information, two, designing appropriate programs, and number three is piloting interventions responsive to their needs. So the Young House Heroes initiative has four objectives. This is to provide technical assistance to the government. Number two is to support and connect adolescent-friendly health facilities, to provide medical and psychosocial services for children at risk and victims of violence, including the LGBTQ+. Number three is to develop guidelines and roll out of safe adolescent and youth engagement services and demand generation, whether if it's online or offline. And next is to integrate mental health and psychosocial support. So it is vital to have a consensus on what young people specifically wants to do in the situation to guide the development of interventions and avoid giving them irrelevant interventions. So in order to cater this, the organizations I've mentioned conducted online focus group discussion through post-dinner chit-chats and roundtable discussions in order to analyze and identify common themes. It showed that during a pandemic, young people would want to have someone to talk to, find ways on how to cope healthily with the situation, be given a space to communicate their necessities, meet new people even if it's a virtual meeting, and number five is to engage in meaningful activities and be productive. One of the outcomes of the activity is the mental health chatline. We have gathered data that the 90% of adolescents and young people prefer to talk to a friend and frown on the idea that they will be referred to the mental health professional. That is why we have come up with this mental health chatline. So the Kaibigan chatline or the friend chatline is a spin-off of the Young House Heroes initiative programs, which equip young callers to act as online and online friends. These online and offline friends are trained to actively listen and use psychosocial techniques and therapeutic communication to provide support to their peers. The Kaibigan chatline will only focus on demand generation and non-specialized support for level 1, 2, and 3 categories based on the intervention pyramid for mental health and psychosocial support in emergency. So the program or the Young House Heroes initiative were able to reach 1,806,699 people, and we were able to train 50 callers. Aside from the objectives I mentioned a while ago, the Kaibigan chatline also aims to improve process of data collection, increase competency and self-efficacy of service providers, and increase knowledge on MHPSS. So the success of the program does not only lie on the services being offered by the program, but also it offered platform for young people to be part of the program and be a catalyst of change. YHHI also does not only focus on mental health, but we have also come up with targeting education, health promotion, environment, COVID-19 response, and economic empowerment. So in our experience, integrated services are more holistic than isolated programs, especially in adolescents. The advantage is that service provider can mainstream the services needs to be delivered. As you all know, HIV is not just an issue of sexual health, but also there are more issues that are correlated to each other, especially the mental health of young people. Also, the integrated services can also lead to discuss more and consider that it encompasses all related health concerns of adolescents. During the pandemic, it's harder to mobilize packs. However, we were able to do so by utilizing the online platforms, by calling in participations and use volunteers to join the program. Next is to engage youth organizations. So on the YHHI, we were able to utilize 45 youth organizations from different regions, and then they need to support and initiate new programs or the existing programs in order to help these volunteers. Next is we were able to partner with local government units or present the YHHI to local chief executive in order to support the program mentioned. So because partnering with local government provides a bird's eye view of the situation in the community, as they have already a large mandate on data collection and monitoring on the ground. So it also influences authorities to adopt innovative approaches from entities with long established experience and expertise. So I guess that's it. If you want to know more about the program, you can visit the Council for the Welfare of Children, because currently we are now on our, we have come up with another Young House Heroes initiative, which currently who pitched their project and now is up for implementation. Thank you.
Thank you, Yvonne, for expressing the importance of integrating mental health and social services as part of a wider health service provision, and also for sharing your success in engaging YKPs in designing youth-friendly services. Not only that, but you offer a really unique perspective of engaging with local governments and how one can best connect young people with decision makers. So thank you so much for sharing, Yvonne, and I know we have some questions, so please do stick around. Our final speaker today, and I'm just going to make sure that she has joined our call. So hello, Dr. Kulkarnia. Thank you so much. So our final speaker today is Dr. Kulkarnia Chogpaibalkit. Dr. Kulkarnia is a pediatrician specializing in infectious diseases with more than 30 years of experience in HIV management. She is currently the director of the Siriraj Institute of Clinical Research, Faculty of Medicine, Siriraj Hospital, Mahidol University in Bangkok. Thank you so much for joining us today. I know you've been very, very busy, so thank you for making the time to join us. So Dr. Kulkarnia, may I ask you to tell us more about HIV treatment services for Yankee populations and young people living with HIV in Thailand? And please let us know how these services have been successfully designed with being youth-friendly in mind. Over to you, Dr. Kulkarnia.
Thank you very much for having me today. I have a few slides to share. Can I? Yeah. So do you see my slides?
Yes, we can see them. Thank you.
Okay. All right. Let me see. How do I? Okay. Here, I'd like to share some of the experience that we have with the young folks who are at risk of perhaps with HIV or those who are already infected, and how do we engage them. Actually, from the past 30 years, we have seen a lot of evolution of both medicine and the way of life of our young folks. So we have to adapt to make sure that our young folks are able to, be engaged into, any system that we have. I'd like to start this with a very quick slide on the HIV snapshot on the incidents to emphasize how important it is that we need to hear and engage and, take care of our young folks. The young people consists of only about 5% of the whole population of people living with HIV. But for the new cases, you can see that the young folks consist of about half of them. So this is not just a picture in Thailand, but it's a picture of everywhere in every setting around the world. So we have to take care of our young folks to make them safe, and HIV prevention and care services that we have should be able to nicely reach them, because they have now the young folks have diverse lifestyles, which is different from my time. My time is like only one fixed style, but nowadays I have a young teenage at home as well, so I understand very well. So in Thailand, our experience, we try to do some innovations by providing a lot of platforms of services to reach out to young folks. We go to colleges, school as the outreach programs. We also go to the places where the young folks gather and set up mobile clinic anywhere that we think that they could be, that they have a very, very busy lifestyle. So we need to be able to make sure that we can reach them at the point where they are ready to listen and ready to engage into the program. We also, just like many other countries, have several programs of peer support, of online, offline services, telemedicine delivery system. And we also have the youth-friendly holistic clinic, which we think that is part of the answer to the question of very busy lifestyle of young folks. We have a clinic called Bangkok Health Hub, and many other clinics like Buddy CU Clinic, Silong Clinic, where we open like late hours and welcome all the young people to come and get the services. The Bangkok Health Hub Clinic is very interesting. They cooperate many services together with the HIV and STD care. They have beauty, have skin care, and they have kind of consultation on reproductive health, as well as many other health related service inside the clinic. So when the young folks go in, they don't feel stigmatized. They could go in for skin care, for acne treatment, or many other things, including HIV care. And you can see that several organizations in Thailand are trying to invent new services to reach out for young folks. However, we still have a lot of challenges, particularly on the HIV treatment and enrolling the young folks into the care of prevention and treatment. It's very difficult sometimes to reach out for young people because they are very busy. They have a job to do, they have college to go, they have many works to do, to take care of. So sometimes we cannot find them. And it doesn't matter how adaptive the service that we are trying to develop, we still cannot reach many young people because of their very busy lifestyle. The challenge also for the folks who are who already have been infected and they've been receiving antiretroviral treatment for a long time, and they're starting to be fatigued of taking the drugs for a long time, our retention to care. Most of the time, our young folks are, very good in, coming to the clinic, talking to us, and we are trying to provide a very supportive, youth-friendly, but that doesn't mean that they will be taking the medications well. The medication fatigue is totally different from adherence to the clinic or adherence to the appointment. So they always come to appointment, they always talk to our case manager, but sometimes they just don't want to take the medicine. So this is something we need to trying to work harder in order to support them, to empower them to take care of themselves for the treatment. Stigmatization is also a big thing in Thailand, continue to be a big thing. So it's very hard for our young folks who are infected to openly talk about it, or even who are not infected but could be at risk or seeking for prevention program, could be very stigmatized to talk about HIV. So this is a big challenge here. And again, busy and dynamic lifestyle make them unavailable to come for any services that we are providing. We also found mental health difficulties, stress and anxiety of the general lifestyle, general day of life, every day of life. They also have a lot of problems there, with the work, with the family, with school. So mental difficulties is something we found more and more nowadays because of the societal situation. During the COVID-19, we found this stress increased even more. And finally, the challenge that we found is from the families and the communities. The young folks do not get good support enough from the families and the communities regarding HIV and STD care. So way forward, there are many things we need to work on. I cannot say that we do good enough. There are many things we need to improve, although we try, but still a lot of rooms for improvement. And I think at least 6 of these items are the things that we need to work together to improve what we have today. Is to destigmatization, normalization of HIV and STD. We need to use innovations to come and to overcome all the challenges that I talked about, particularly on the self-test, which is so unfortunate that it is not widely available over the counter in Thailand, despite that we are the country that produced this self-test from the very beginning. But because of rules and regulations, it pushed us behind in terms of availability of the self-test. So we are working on that to have self-test available for everyone that want to test for themselves. We need to develop our digitalized services and telemedicine to be stronger. Thanks to the COVID-19 situation here, that we have been improving a lot in terms of this telemedicine and digitalization service for services, because we cannot do a lot of face-to-face services anymore. So we have developed, improved many things. This is one of the good things about very little things about COVID-19 situation. Okay. And the long-acting antiretroviral drugs or PrEP drugs, could be by injectable or implantation. These also including the contraception methods where we should have something more innovation coming along. We cannot emphasize enough about mental health support, which is not widely available in every hospital, every healthcare settings. We do also need to, provide gender-sensitive needs, many things, hormone therapy. Many kids I wouldn't say kids, young folks, you know, who require hormone therapy cannot get it over the counter, and they have to do like, you know, from the unauthorized places, and would be at risk for the danger from the not correct, incorrect medications. We need to improve and, you know, have more youth-friendly services, and clinics should have the active case managers more. We have to provide a service with flexible hours more than what we have right now. And mobile services where the young folks are, you know, easy to access. And finally, you know, we also need to set up the programs for the parents and the gatekeepers. All this, we hope that it will make us through the better situation than what we have right now. All right, I'll stop sharing. Thank you.
Thank you so much, Dr. Kulkarnia, for sharing your successful experiences and also addressing some very significant barriers and challenges towards HIV treatment and enrollment in care for young people. I hope that platforms such as these give an opportunity for all of us to come together and learn best practices for addressing these challenges and successfully reaching out to these young people. I think your examples of ways forward are tangible and innovative solutions to bridge that gap between service providers and young people. So thank you so much for sharing. If I may start the Q&A round now, I'd like to start with you, Dr. Kulkarnia. So our question for you is, we know that youth-friendly services go a long way in promoting adherence to ART, PrEP, and access to HIV prevention and treatment services. How are healthcare workers / providers trained and sensitized to young key population issues?
Well, that's a very good question. Many of our healthcare workers are not comfortable working with the young people. You know, sincerely, it ends up, you know, I'm a pediatrician, and it ends up that, you know, pediatricians are probably, you know, the place to land on to take care of the young population. The point is that for the general medical care, we have the 15-year-old age cutoff because they grow too big. They larger than the beds that we have at the pediatric floor. So over than 15 for general care, they will be referred to.
Just give a moment. I think we may have lost Dr. Kulkarnia. Okay, whilst we wait for Dr. Kulkarnia to come back, can I invite our other two panelists, please, Yvonne and Tung? Oh, Dr. Kulkarnia, you've
sorry, I was disconnected. Yeah, I don't know when was I?
Just finishing up about how they're too big for the beds.
Yeah. So for general medical services, the cutoff is 15 most of the time. But then, you know, for taking care of reproductive health, HIV, STD, we need to increase the age, you know, to at least 18 or 20. We found that if we transferred our young folks to the adult clinic before 20-year-old, the outcome of the treatment is not as good. But if we keep them with pediatric clinic, you know, it will turn out that they're doing very well. And at the time that we transfer them to adult clinic, after 20-year-old, we found a better outcome. So likewise, when we provide services on the HIV and STD, reproductive health, treatment and care, prevention, everything, you know, it turned out that pediatric care is more suitable for the young population. But in the same time, the people who are working with children are not that very familiar with very, big kids. And the adult clinic, they are not familiar with, apparently adult, but the heart is still, like teenagers, like still young, So these are the gaps where it's sometimes very, I have to admit that even healthcare workers is still the gap to improve. We need to, train more the healthcare people to take care of the young people, the young adults and youth. Again, this is one of our barriers as well. We provide a lot of trainings, but it's still not enough. We don't have enough case manager. But in the places, what we found, in the places that have good case managers, the outcome of treatment for our young folks and the reaching out to our young folks has better outcomes. Yeah.
Thank you so much, Dr. Kulkarnia. Well, we're so happy to have the perspective of a medical doctor. It's very rare that we get to speak to someone who has this kind of experience during one of these calls. So thank you so much. Please stay with us. I do have one more question for you, but I'd like to invite the rest of our panelists, Tung and Yvonne, to quickly join us. I have a question for you, Tung, if I may. As it has been reiterated that stigma and discrimination should be addressed to provide an enabling legal environment, and most of the time stigma and discrimination is also at an intersection with injustice and inequality. So my questions for you are, what will be the best strategy to overcome self-stigma amongst young people? And also, what will be the best action for the inclusion of young people to ensure that we reduce the gaps of barriers towards young people, particularly for YKPs and young people living with HIV? Over to you, Tung.
Thank you very much. I think that is very hard questions. We're trying to answer in over the years when we see the increase of the HIV among the community, and it's result from many studies that self-stigma is still a very big barrier for them. About the strategy, I think for now we need to have at least, I think for now we need to have more data on self-stigma and internalized stigma among the community, because our knowledge about self-stigma is still very small, and we need to expand it to understand why communities still stigmatize themselves. Even that we can see there are a lot of information about the HIV on social media and also in the society. From the experience working with community, I think the first sex education really much needed is have to very inclusive. It's need to include the community, the young key population in the sex education since a very beginnings of their education from the primary school and also secondary school. They need to know about the different populations and also about the HIV and AIDS and sexual health as well. I think that the second strategy is that now we have a lot of social media channels. So we definitely can optimize the social media to promote for the very positive message to the community. We collaborate with UNAIDS Vietnam to run a campaign, social media campaign is called My Health, My Choice. So we're trying to increase the confidence of the community to address their own self-stigma, and they have to responsible for their own health and more proactive in seeking the health services, to get the well-being. And I think law and policy also really need to change. They are like in many countries, the MSM people, the people who use drugs, and also the people, the sex worker people are still very, they be criminalization. They face with the a lot of the punish from the government. So we need to change that. We need to advocate for the enabling environment for the community to equal access to the services without any stigma and discrimination. I think that is the very mutual effect, the self-stigma and also with stigma from society and also healthcare setting is really affect to each other. So we need to reduce both of them and also integrate the community with the broader society to make sure that they exist, they have the spaces to raise their voices and also to visible in anywhere in the family, in the school, in the healthcare setting, and also in the workplace as well.
Thank you so much, Tung, for unpacking that very difficult question. And I completely agree. There's a huge gap in a need for data on self-stigmatization. And not only that, as you said, it's twofold. The issue comes not only from self-stigma, but also the stigma discrimination faced by YKP and LGBTI and other communities from the general population, and also due to punitive laws. So creating an enabling environment is one of the first steps to ensuring and supporting young people to not be experiencing self-stigma. So thank you very much, Tung, for your sharing. This question goes to Yvonne. So Yvonne, data has shown that the Philippines has one of the fastest growing HIV epidemics in the world and the fastest in Asia and the Pacific. From 2010 to 2020, new HIV infections have raised by 237%, concentrating among key populations, particularly young men who have sex with men and transgender women. What do you think is needed to bring this trend down and to get the HIV response back on track in the Philippines?
So, hello again, good afternoon, this is Yvonne. I think what we need to do is that in addition to the interventions for prevention, treatment, and care of HIV, Yankee population also requires non-HIV related services to respond to their significant health and development needs as adolescents. So we would like to recommend that the sexual reproductive health services should also contain or should also integrate other services, including social services for and to uplift their quality of life. Also, we need to institutionalize comprehensive sexuality education to address the low comprehensive knowledge on prevention and transmission among young people population. I think this has been lacking in the educational system in the Philippines, and we're trying to really come up with programs in order to combat the stigma, discrimination, and other issues related to HIV. And also, I think we have to expand and increase the access of human the HIV services for the Yankee population by establishing safe spaces and adolescent-friendly health facilities. We have already these kinds of facilities in the Philippines. However, I think the places such as in far-flung areas cannot access to this. That is why we're trying to really come up with or utilize the telemedicine. So I guess that's it. Thank you.
Sorry, I muted myself. Thank you so much, Yvonne. And I agree that the need for information and the need to integrate SRHR into the education system is paramount in addressing HIV in most countries, especially in Asia and the Pacific. With that said, I do have some more questions, but unfortunately we've run out of time. So I'd like to take this opportunity to thank our three panelists today. And thank you so much for being part of this discussion. We do have some further questions, so perhaps after this meeting, I can share them by email and we can then share it with our viewers today. So thank you once again to Dr. Kulkarnia, Yvonne, and Tung. Thank you so much. So in our next panel, I would like to invite Mashina Pulsawat from Unicef Thailand. Over to you, Mashina. Thank you so much.
Okay, thank you so much, Honey. And that's so great to hear many good practices on integrated HIV program addressing young people in our region. And now let me welcome you to session 4 on innovation and young people and young key population leadership. My name is Mashina Pulsawat from Unicef Thailand, and I'm moderating this session. And here we have 4 wonderful speakers, Legi Tamir, Apple Star, DaCosta, Dr. Wanda Viegas, and Tono Permana. And without further ado, let me introduce our first speaker, Ms. Legi Tamir from Youth Lead. Legi is currently a project and networking officer at Youth Lead, Asia Pacific Regional Network for Young Key Population, and she is a former CCM member and coordinator of Young Lead, Mongolia. Today, she will cover the topic of young key population engagement and leadership in the global fund processes and the national HIV response. Legi, the floor is yours.
Thank you so much, Mashina. So I'm really happy to be here in that meeting. So we all know that the participation of young people, especially young key population, is not sufficient at all in the country HIV response. It is regrettable for me as a young key population representative, as a young person, and as a person who works with young people, and that we often encourage the community engagement, leadership, and then community empowerment, but we do not have enough YKP involvement in the grounds only based on the age and having less experience, which is not really true. So last year's qualitative interview with the YKP leaders of 8 countries, none of them were responding. They have fair and adequate participation in country level in HIV response. So it might prove that what I'm saying is not that only empty words. So, however, I'm pleased to report that the YKP-led organization groups are started participating, involving by expanding the meaningful engagement in the national HIV response and as well as the global fund process through the efforts of young leaders who are working so hard and with the support of the regional mechanism and then organization and other agencies. So to engage in the process of the biggest HIV donor for countries, the Global Fund, it is the huge and the most effective step for young people, and it guides and ensures to the further engagement if they want to lead and meaningfully involve in the national HIV response. So as a regional network, we work for Asia Pacific countries, which means as supporting them, we count their achievement as our output. So I want to share a couple of examples of the countries that we see them doing pretty good and great engagement in the national response. So firstly, I would like to share about Indonesia. Starting from 2015, Intimida has started advocating for the integration of young key population issues into the HIV programs at the national level. Since then, until now, in the organization, they have started to provide capacity building for members on how to get involved in the proposal development and decision-making process for the Global Fund, and they have received support from the Youth Lead and the other key population organization and then agencies. So it's usually like that. All YKP-led organization or just youth-led organizations start its meaningful engagement by building capacity, knowing more about the sector and the stakeholders and the effective advocacy tools. So initially it went well there and they started to represent young key populations in the country coordinating mechanism of the Global Fund in Indonesia with the support of Ministry of Health and UNICEF Indonesia. They implemented Lollipop program that advocated many young people and the youth and started initiating youth-friendly HIV prevention services. And not to mention, by giving much input and a meaningful contribution to the planning and decision-making process, for the first time, a young key population is prioritized in the 2015 to 2019 HIV National Strategic Action Plan of Indonesia, on the base of the documents of the Global Fund. So my next example will be Mongolia. As of 2018, Mongolian partner YLM, with the support of UT Regional Network, started to step-by-step ensuring YKP's participation in the national HIV response. Through back in that time, there was no any youth or YKP representative in the Global Fund CCM, and then young people would not be able to participate in any decision-making process at all. And then in addition, they even could not get any right and necessary information, national HIV data or the other database. But our focal point managed to be elected as a first youth CCM member and became part of the decision-making body after doing several small-scale advocacy works and a little bit lobby. So as a result, Youth Lead Mongolia has been conducted numbers of YKP consultations, dialogues for the measure of Global Fund projects such as National Grant and the COVID-19 response mechanisms, etc. And they have proved that specific needs of YKP and included in some other activities for youth and YKP in the main proposal. So apart from the conducting consultations, our focal point has been working with the technical working group of proposal development and development in national level, and developed the case study about the meaningful engagement process to share the experience with all YKP leaders in region and to encourage them engage more and more. So at the end of my speaking, I would try to narrate why Yankee population should engage more and take some part of the lead in the national HIV response. First of all, we know better about Yankee population specific needs, perspectives, and the methods that work really well for Yankee vulnerable population to prevent from HIV, and the issues, challenge that young PL-HIV Yankee population face each and every day. And youth groups and organizations are able to build peer-to-peer capacity and advocacy by using the new technology and innovative approach. Since we have heard a lot of the statistics and numbers and the new infection among people aged between 15 to 24 and the young people's experience, how they're working, I hope you are all kind of agreeing with me. And I want to strongly encourage UN agencies, regional organizations, regional networks, global networks to keep financially and then technically support that grassroots local organization until the whole world can recognize us as a decision maker and a crucial community. So that was my speaking. Thank you so much, everybody. I think
sorry, I'm on mute. Okay, thank you so much, Lege. This is so fascinating to see that despite how hard it is, Indonesia and Mongolia still manage to get the meaningful participation from young people. So now let's move to the new topic on partnership between government and young KP-led organizations in HIV service. And we have two speakers here, Apple Star from Human Touch Foundation and Dr. Wanda from Goa Medical College. Let me introduce Apple Star first. So Ms. Apple Star da Costa is a program lead on psychosocial support and at Human Touch Foundation in India, working for adolescents living with HIV and those using substance. And she successfully integrated mental health care into HIV continuum of care for young people. Apple Star, could you please elaborate more on that? Thank you.
Thank you, Mashina, for the introduction. Good day to all the attendees of the event. Today I'll be speaking about our organization and the services that we deliver to adolescents and young people living with HIV, our collaborations with the local state government, and our initiatives with relation to COVID relief. So starting with just giving you a brief about Human Touch Foundation. Human Touch Foundation is a non-profit organization that works in the state of Goa, India, with the youth for the youth. Our mandate areas of work include HIV, sexual and reproductive health, substance abuse, and tuberculosis. So the services that are rendered to our clientele are strategically tailored to ensure that all young people have access to good health, well-being, and human rights. We engage in a need-based, comprehensive, sustained, and holistic intervention through a community-based model. And under this program, the services that we deliver, the most important one is psychosocial care and support. We know that HIV-related stigma, loss, and bereavement of a family member due to HIV, interpersonal problems, lack of future orientation, minimal treatment and health literacy, treatment fatigue, depression, and anticipatory anxiety are some of the major concerns that are projected by adolescents and young people living with HIV. And mental health professionals at Human Touch use a detailed assessment taking into consideration every aspect of the individual, be it medical, psychological, social, family, educational, etc. And we identify the issues and needs of these young people and use an eclectic approach where strategies from varied psychotherapies are tailored to address the issues presented by the client. And apart from having one-on-one therapy and counseling sessions, we do engage in other modalities to address these issues like support group meetings, family intervention, and also psychoeducation. Next service that we give is social and legal protection. As we know, social protection plays a key role in reducing poverty and inequality in the community, and it enhances social stability. So under this service, we as an organization help our clientele to gain awareness of the different schemes that are available to the government, and we subsequently link them to these schemes. Through our advocacy initiatives, we have been able to successfully engage in giving travel concession to our beneficiaries. So Human Touch undertook the initiative with the State Transport Authority to waive off travel fees for people living with HIV and to make it 100% concession from what was earlier a 50% concession. And as we see, this has significantly reduced the financial burden of people living with HIV who rely on public transport for their mobility. Second is the viral load testing. Viral load testing is one essential facility that was lacking in the state of Goa, and laboratory samples were being sent out of the states to get the results. Human Touch, along with other organizations working with people living with HIV, proceeded with the Goa Human Rights Commission and successfully had the state government set up a full-fledged laboratory for virological studies in the year 2019. Coming to pre-marital HIV testing in 2019, the state government had planned to make HIV testing mandatory before marriage registration, and Human Touch along with UNAIDS India did not support this decision on the grounds that it violates the rights of people living with HIV, and we were successful in preventing this mandatory pre-marital HIV testing. Our third most important service is food security service. Good nutrition is important for everybody, and a healthy immune system is maintained when we eat well. HIV can lead to immune suppression, and hence food safety becomes a priority for adolescents and young people living with HIV. Good and nutritious food intake helps prevent further infections. And in order to maintain a balance in the food and food intake, adolescents and young people living with HIV are supported with monthly food package consisting of dry supplements like pulses, milk, and other immunity boosters. Many young people living with HIV who have been in childcare institutions are left to struggle and to rebuild their life on their own, as they are asked to move out of the facility after attaining the age of 18 years. And through a residential aftercare facility, HIV assists these young people with accommodation, with assisting them to complete their education and gaining employment. And we also help them to engage in skill building sessions so that they become self-reliant and independent. In order to facilitate emotional well-being and build hope and eradicate social isolation associated with the HIV epidemic, Human Touch also organizes residential camps, field trips, and other fun activities where adolescents and young people living with HIV are given an opportunity to get together, to freely participate and express themselves, gain knowledge, and also build a strong support system with their peers. Education and employment, as we know, adolescents and young people living with HIV who are unable to complete their higher education. Human Touch, through different sponsors, focuses on providing education opportunities for these young individuals. And we help them by providing sponsors that focus on giving financial aid. And our organization also helps our beneficiaries to access the different government scholarships and grants that are available. Human Touch also ensures that employment creation for young people living with HIV is done by organizing entrepreneurship workshops and also linking these potential clients who are seeking for jobs to employers who are seeking to hire someone. Now, coming to the collaborations with the state government, we engage in stigma reduction initiatives where our organization, in collaboration with the Department of Education and Goa State AIDS Control Society, organizes numerous sensitization workshops for heads of education institutes, where we attempt to improve the approach used by education institutes while dealing with children is organized by our organization World AIDS Day. This annual fest is organized in collaboration with the Goa State AIDS Control Society and Department of Health and Family Welfare. Young people from across the state are engaged in this fest through interactive sessions, through competitions, games, film screening, testing, etc. Through this festival, we aim to raise awareness about HIV, to eradicate stigma and discrimination, and encourage testing among the younger generation. We also hold workshops with law enforcement. Goa Police, in collaboration with our organization, conduct workshops for law enforcement personnel, creating awareness about harm reduction programs. And the purpose of this workshop is to basically sensitize police personnel to understand the varied services that are delivered by Human Touch under harm reduction program for people who inject drugs, and also to ensure that people who inject drugs access these services without hesitation, thereby preventing the spread of bloodborne infections like HIV and hepatitis B and C. We also engage in community-based testing, so aiming to identify individuals who are positive for HIV at an early stage and to prevent the progression of infection to AIDS. In partnership with Goa State AIDS Control Society, Human Touch provides rapid testing services in the community. And these services involve counseling, which includes pre-test and post-test counseling, referrals to the ICPC centers for confirmatory results, and also to link to treatment and other care services for people living with HIV. In response to the COVID pandemic, some of the initiatives that Human Touch engaged in was deliveries of ARVs. Although various services were available to adolescents and young people living with HIV, accessing them due to limitations of mobility was difficult, especially for individuals who relied on public transportation. And in order to make services easily accessible to this population, volunteers and staff of Human Touch Foundation, in collaboration with the hospital officials, initiated and delivered medicines at doorsteps. Through this initiative, more than 200 people who were on ART treatment were assisted to get access to the ARVs. And apart from locals, around 15 to 20 foreign nationals who were stuck in Goa due to the lockdown were also helped through the ARV delivery service. The second most important was the psychosocial support. We saw that the emergence of COVID-19 spiked chaos and mental distress among adolescents and young people living with HIV. Fear, anxiety, stress, and signs of depression were some of the most common mental health issues that arose as a result of the lockdown. We saw that idleness, social isolation, unemployment, financial insecurity, fear of contracting COVID-19, and limited access to online education were seen as contributors to mental stresses. So in order to tackle this issue, we used a hybrid model of mental health care services where we adopted and delivered psychosocial support, and we used online counseling as well as in-person counseling. And in order to tackle these issues, interventions incorporated a combination of, as I said, telephonic and in-person counseling sessions. And wherever we saw the need to engage family members and caregivers in the intervention, it was taken into consideration. Thirdly, we engaged in food security program. Due to restricted movement, families faced unemployment as majority of them belong to category of daily wage workers. And financial insecurity increased the burden of anxiety as these groups do not have access to basic food and hygiene needs. Parents and guardians fear and worry that their children would face malnourishment, and they would have to compromise on the nutrition intake. To promote a healthy diet, Human Touch Foundation with support from varied entities like UNAIDS India, Youth Lead, faith-based organizations, the hospitality industry, and even individual donors mobilized and distributed nutrition packages and hygiene kits to these families. Lastly, when it came to access to education, we saw that COVID-19 caused a major disruption in the educational sector, with teaching shifting to an online platform, and children and adolescents living with HIV, especially those coming from poor families, were significantly affected by school closure, and it only exacerbated the learning crisis of this population. And it also contributed to high levels of anxiety and stress. And so in order to help them further, after carefully assessing the need, electronic gadgets were circulated to children from disadvantaged families to enable them to get access to the virtual education. Yeah, with this, I end my presentation. Thank you.
Okay, thank you so much. That's wonderful. And it is such a well-rounded program, Apple Star. Thank you so much. So now let me hear from the government side, Dr. Wanda, and with her 16 years of experience working with PL-HIV in Kolkata, Dr. Yu J. Wanda is currently a senior medical officer at the ART Center, Goa Medical College. Dr. Wanda, may I invite you to present the role of Goa government in providing HIV and health services to young people living with HIV? Dr. Wanda, are you still with us?
Can you unmute this?
Okay, now we can hear you.
Yeah. Okay. So I'm. Thank you very much for giving me this opportunity. Thank you very much for giving me this opportunity to talk on the services that we deliver. Good afternoon to you all from this beautiful state of Goa. Now we are associated with the working with HIV people for the last 16 years. And presently we have around 8,000 people registered, out of which 300 are young adults and 365 are children in the age group of 1 to 15 years. Among all the services that we provide in the ART Center, We try to make things as friendly as possible to the children and the people visiting the ART center. And there is free investigations that are given to the people. There is access to ART, first line, second line, third line ART to all the people, including the children. They also have access to other departments like surgery, gynec, pediatrics, and we have something called multi-month dispensation, wherein 3 months medicines are given to the people so that their visits are less in the ART center and the contact with other people, especially during this COVID times. You know, they should not contract the COVID infection from the other people. So they are allowed to take these medicines for 3 months. Now, the government has some programs which are youth-based and in the state, like the adult education program, which empowers the youth about themselves, their adolescence, their sexuality, the basic facts about HIV and STI. They empower them with knowledge to protect themselves, to do away with misunderstandings and with misconceptions about HIV, AIDS, and STIs, to find ways to fight the pandemic. And in these, the teachers are trained by Goa State AIDS Control Society to impart knowledge to the young people in the school and colleges so that they in turn can go and give this knowledge to the other people. Then we have the Red Ribbon Club, which is a club of young people in the professional schools and colleges, which helps in imparting knowledge about HIV/AIDS. We have, in collaboration with Goa State AIDS Control Society, the celebration of International Youth Day on the 12th of August, and the National Youth Day on the 12th of January. We also have World AIDS Day celebration on 1st December, wherein people from all walks of life, from all age groups, including the youth, are called forward to have marathons, then cycle races. There is use of digital platform for various activities, and the youth are asked to collaborate with NGOs like Human Touch, Udant, Zindagi to bring about these activities. There are webinars which are organized. Young people are helped by these NGOs to get their documents so that they can avail of government scheme. The government gives 2,000 rupees to these people on a monthly basis. Also, there is a free bus pass, which is for travel within the state, which can be accessed with the help of the NGOs. The state level quiz competitions are organized so that there is awareness created among the people, especially the youth. There is a Tree of Life program wherein the tree is decorated with red ribbons and small cards with messages for the young people are put on these trees. And I also want to throw light on our COVID situation here during this pandemic. In the year 2020, last year, there were not many cases and we were able to give ART to the people because of the travel restrictions through the NGOs like Human Touch, Zindagi, Udant, which helped us to help reach these medicines to the people concerned. This year, it is well organized and we have people coming and collecting their ART. We also have, we have been extending ART help to foreigners from different countries. We are around 13 countries, people who were stuck over here, majority of them from Russia and from the Europe, who took access to free ART from the ART center. We have telecommunication, telecounseling services for the youth, especially now during these pandemic services, pandemic times. In the afternoons, our counselors are involved in talking with people. And last, I want to thank all these organizers who have given me this opportunity to talk about all the good work that we do and to help us overcome this HIV pandemic. Thank you.
Okay. Thank you so much, Dr. Wanda, for the perspective from the government. And I have to say that being government is quite difficult, I understand, but you managed to do so many things and being flexible. Thank you so much. And now we have come to the last panelist, Mr. Tono Permana from Indonesia. Tono has been an HIV activist since 1992, advocating for MSM and TG program in Indonesia. And today he will cover the topic about the use of digital platform on health and HIV and how the platform engages influencers and content creator in relation to ASRH and demand generation for young KP. May I give the floor to you, Tono?
Hello. Good afternoon, everyone, and thank you for Monsisa for the opportunity that given to me to share our experience on innovative HIV and SSR dissemination informations and health service promotions through social media and internet-based. And I would like to congratulate to Youth Lead for organizing this important side event that will feed important input to the HLM. So, saya berani mean I'm brave. This is the meaning of the saya berani. This social media campaigns is actually initiated by UNAIDS Indonesia and also the community-based organizations forums. So brave mean brave to find correct information about SRH, HIV and health services, brave to access self-risk on HIV and STI, brave to access test center, and brave to continue to treat. So here's the problem in Indonesia lately, I mean, in the last 1 decade. Young people still lack comprehensive knowledge on HIV, like Dr. Yeyu mentions in the first presentations. On our last national survey in 2017, this is quite late, only 14% of men and 14.5% of women on age 15 to 24 have comprehensive knowledge on HIV. So it's very low, only 14%. And young people between 15 to 24 are 50% of new infection in Indonesia. And estimated the new infection in Indonesia is about 32,000. And there is the anecdote about people still asking basic HIV questions like, can I get infected from mosquitoes, from kissing, from hugging, like, etc. And there is actually so many internet-based information platform until now that provide information about sexual reproductive health, STI, and HIV, but mostly it's very passive. And we know exactly how young people characteristic. They want to be active. If they want to ask something, they want the answer as soon as possible. But this existing social media platform is really passive. In Indonesia, internet penetrations in Indonesia is 64% with 17% growth, or about 25.3 million users additional every year. So it's third highest in the world. And 64% of internet users online almost 8 hours per day. And 4.4 hours 45 minutes on mobile internet usage. So it's very potential for us to do this project. So, and then 17% of social media audience is young people between 18 to 24, and 60.5% young people between 25 to 35. So mostly people who access the social media or internet is young people. So from this background, we try to establish the new social media campaign using internet and social media, and we call it Saya Berani since 2016. And almost 40% of the visitors of our platform is young people. So we use multimedia, Facebook, Instagram, Twitter, website, YouTube, and encourage visitors to access hotline counseling. When they access the informations, we bring them to the counseling WhatsApp application number, and they can also send any questions by direct message that will respond directly by our hotline admin. So the goal of these activities of this project is actually to increase knowledge and generate demand to HIV services, because until now we see that the access from the key population to HIV test and treatment center is still quite very low. So in 2018-2019, Saya Berani connected user to counselors, and then the counselor will refer people to testing services. And in 2020, beyond of this, we also promote use of new services in Indonesia, for example, PrEP, community-based screening, youth-friendly services, and sexual health services. We also try to engage young people and people living with HIV as an influencer. Not only talk about, discuss or mentions about HIV, but also their social life and how they maintain their healthy life and everything. So we make the profile of them and we upload in the Instagram or Facebook or our websites. And we also have a discussion, direct discussion, live discussion on Instagram Live, for example. So it's make the followers or the visitors can actively involve in our campaign. And surprisingly, when we first launched these programs, I thought it's only people who want to know what is HIV or basic information. But actually, almost half of the visitor is PLHIV, and they ask a lot about the treatment, side effect, how to maintain their happy and healthy life and everything. So we also make a content related to motivation, provide more good motivations, and they can stay on treatment. We also want to make sure that our product are fitting to the needs and behavior of the community. So actually, before we create the content, we also conduct a FGD or survey, and then we try to get input from the followers or for the visitors, and then we create the content. So, but because the concerns and challenge, because Indonesia is very conservative, like you know, so while we try to get options, so Saya Berani is very for general public, not for specific key population. There are some campaign for MSM and PG, and I also involved in the process of the establishment. So because of this, we hope that Saya Berani can reach not only key population or PLHIV, but also hard to reach, or people say hidden populations, including young key populations or young populations. The concern about anti-LGBT is still big issues in Indonesia. So we also, when we create the content, we also have to think about this. We try not to make a very hardcore message, but in this, for example, in June for Pride Month, we just try to make a slide with a lot of rainbow, and it seems nothing happened. There is no protest or there is no report about this. So, but if we talk about the sexual things, so we have to use very soft language, not hardcore. So we have to be more creative on create this content. So, and the other concern about our project is there is no sufficient funding to support this activity. So mostly our activities is based on voluntary. So, and like you said, like you know, the voluntary-based activities is sometimes can be very good. Sometimes it's not really good. So we really need some people, young people or key populations who have very good voluntary work. So because of, actually, when we make these programs, we also think about the sexual, comprehensive sexual educations that in Indonesia is not really exists. There is, but the implementation is very little, not really, very weak. So I hope this comprehensive sexuality education in school that is not yet realized in the can be negotiated in the HLM, especially for some countries that are not supporting this CSE. And because some countries is not, for example, and Indonesia is not really supporting the CSE, our program try to work on it and try to give our best to give more informations, especially for young key population or young people in general. Thank you very much.
Okay, thank you so much, Tono. That's wonderful, and I really like the website, the Saya Verani
Yeah.
website. That's so wonderful. So I hope that we still have some time for a question. There are many questions for all of the speaker. So I will start with Leggy. So your question is from the floor is that what do you say to the countries that do not have strong youth networks or young KB networks, and how can young people get involved?
Thank you for the question. So I would say it probably depends on that country context. But in common, I would give a suggestion, but it's not limited by my answer at all. So first of all, maybe it's better to find that passionate YKP groups or colleagues or the partners that have the same vision and mission with you together. And gathering together, you guys can start some, initiate some small scale advocacy work, no matter what size is it. So, and the other thing can be reaching to the other stakeholders, like key population networks, or just the youth common councils or whatever it requires. And the last one can be reach out to the regional mechanisms, regional networks that can help to build the needed capacity, and maybe attend to the trainings, because we are always like really happy and really welcoming any Yankee population across the region. So that's my 3 suggestions, but it's not limited. There's a lot of other different ways. So thank you.
Thank you so much, Leggy. I think that's a very good take-home message. So first, start small, but recruit those who share the passion and find good allies on that and find the original mechanism that you can leverage on that. So thank you so much. The next question is for both Apple Star and Dr. Wanda. So how do you engage with adolescents or young people who don't have gadgets during the time of COVID, when everything has to be virtual, and those in rural areas, how do you engage them, and how do they get enough IEC material? Thank you.
Thank you for the question. Yes, everything during COVID has gone on a virtual platform, and we saw to it that this did not cause a barrier in delivering our services to our beneficiaries, and no person was left behind. So yes, we did engage with people coming from the rural areas. So all us, we engaged in something called as outreach work, where we delivered our food packages, to the families at their homes. Similar way, ARVs in collaboration with the hospital officials was delivered to their homes. When it came to psychosocial support, we did engage in tele counselling. And although those people living in rural areas do not have access to a smartphone, the family members did have access to a phone which was ideal for calling and sending SMS. So we took best advantage of that, and we engaged in tele counselling, not involving in video counseling. And once the lockdown measures were relaxed, we engaged in-person counseling while keeping the SOPs in mind. Yeah, and when it came to ISC materials, we did give away ISC materials while distributing the services. But we did see that we saw to it that we followed up in trying to understand whether the beneficiaries understood what was there in the ISC material, and we guided them accordingly.
Thank you so much, Apple Star. Do we still have Dr. Wanda here with us? Dr. Wanda, can you please unmute? Thank you. So we have the same question for you.
During this COVID time, especially, we had a lot of problem. And so we are associated with this network of people, like all the NGOs, and we have a Vihan, another NGO, which helped us to reach out to the people to make sure that ART was given to them, and even some amount of little counseling was done. So basically, we reached out to the NGOs to help us, because we cannot go to the grassroots level to do the work. We are based in the Goa Medical College, so we had to take the help of the NGOs and do the work of providing the services. Yes, thank you.
Thank you so much, both of you. That's wonderful. And without further ado, we have the last question for Tono. The question is that thanks for the presentation, but the concern comes to the engagement with young people, to the leadership, especially those who are hard to reach. And what is Indonesia doing about this, and what model should Uganda learn from innovation as well?
So it's actually a very hard question. So we also been there in that situations in 2012, I think, when the first time I tried to encourage young people to lead their own programs, and I also encourage them to form the PLHIV not PLHIV network, sorry, but for key population network, young key population network. At that time, young MSM and TG network. So if you see the presentation talk about Inti Muda, I think Inti Muda, the embryo from Inti Muda is come from that process. We really have to give them fully in charge for their own programs. But the most possible things, we have to engage them in the big cities first before we go to the hard to reach areas. So, and then they will make a network, and the network will strengthen to their own network to the hard to reach to area. And related to innovations on the the internet-based project or social media campaign, I'm really sure that all young people now, the millennials, is really understand about this technology. So when we give them responsibility, I think we can. I think they can do that for themselves. What we call it, we just monitor and become a mentor for the first stage, and then they will do rest. Maybe that's from me. Thank you.
Okay, thank you so much. So your suggestion is that first, let them fully in charge of their own thing and start from the big city first, and then they'll start to snowball. And for the internet base, you can be the catalyst and coach them, and young people will grab that very fast. Okay, thank you so much for all fascinating speakers. I really appreciate all of your hard work and your generosity to share it with all of us. It's such a regret that we have so little time to learn about all this. And now let me hand this over to Gash Garung, Regional Coordinator of Youth Lead, for the wrap up of today's session. Thank you so much.
Thank you, Monsita, and thank you to all the incredible and passionate speakers who have kindly shared their experience and stories, and especially to all the viewers, actually all over the from all over the globe, who are very engaging. I think this was very inspiring, and especially when we ran over the time, like almost around like 30 to 45 minutes, but still the engagement and the spirit remains same. So, and also I'd like to really apologize that we couldn't address all those insightful questions due to time constraint. So I won't dare to summarize this very rich discussions. We'll just document it, and then we'll try to share to all of you, to different stakeholders and all of you. But I guess the diverse experience and the messages from the government, the donors, UN, civil society, Yankee population, service providers, and technical partners, actually all of those diverse messages and experience really make this event very special, ahead of the high level meeting on HIV and AIDS. So we really hope that the key messages from this side event will kind of make some differences in the finalizations of the political declarations. So I'd like to quickly point out a couple of things. So firstly, I'd like to again reiterate the importance of preserving the regional issues. That's unique to this region, because often there's regional nuances. They often get generalized or lost at the global level. So that's why it's our objective that we keep advocating for the a particular and unique issues of Yankee populations in this region. And then secondly, we'd like to urge especially all the member states and the stakeholders to have a bold, explicit, and empowering languages in the political declaration that can halt and reverse the HIV response on Yankee populations and key populations. I mean, in 2016, as Ika mentioned, we have the term key population. So we really hope that with this 2021 political declarations, we'll also have included different other issues, including Yankee populations. And we also like to urge and demand the member states through this platform that there has to be a removal of the harmful laws and policies that obstruct the progresses within the HIV response. In particular, I guess we really demand for the decriminalizations of the drug use, sex work, same-sex relationship, and repeal all these laws that breach the rights and also hinders accessing the essential services that saves life. And we also urge, for the scale up of the HIV prevention and youth-friendly services, which we have discussed, in depth. I think without youth-friendly services, we really cannot cater the needs of the bulging, YKP, populations, which our YAU has already kind of highlighted, the number of new infections that's been increasing dramatically, if we compare with other key populations. And also, finally, there is also issue of funding. A lot of youth-led organization, and in particular the Yankee population-led organization, mostly missed out the funding opportunities, and without that opportunities, the advocacy may not be effective. And also, there is an increasing trend of domestic funding, but as to our knowledge, I think none of the domestic funding until now has been targeted to Yankee population. So we really urge, donors in the member states for the flexible and enabling, not just flexible and enabling funding mechanisms for the Yankee populations. And finally, we have briefly talked about this YKP data initiative, which was the inspiration to this event. So we'll kind of be launching, finalizing and launching this this report very soon. So we'll keep you updated on the progress with this report. So I'd like to close this side event by borrowing Ika's message from her opening remarks. He told that Yankee populations are leaders, partners, and implementers. We're not the tick of the box. Thank you, everyone. And then stay safe from COVID, and then have a good week ahead. Thank you.
Thank you.
Thank you.
So before we move out, Eddie, do you want to do any group picture or anything?
Yes, that'd be great. If the speakers and panelists could turn on their cameras, that would be great so we can take a screenshot. I'm so sorry for our guests who are joining us who didn't speak today, but you can leave the meeting if you would like to, or just stay and watch us take the photo. It's up to you. But yes, please, if all the panelists can turn on their cameras, that'd be great. Okay, give me 1 second.
I think I cannot start my video because it says the host has stopped it.
Okay, wait, give 1 second, Apple Star. You should see it now.
Yeah.
Okay, great. Smile. Great. Great. Thank you so much, guys.
Awesome. Thank you, everyone.
Thank you.
Thank you.
Bye.
Thank you. Bye-bye.
Bye-bye.